Thank you. It's really a fantastic pleasure to be here and really a tremendous honor as well to be here with you tonight. I want to start by saying thank you. I owe big intellectual debts to lots of friends and colleagues for helping to crystallize a lot of the thinking that I want to share with you tonight. In particular, I want to call out Richard for his leadership and Sir Andy Haynes for his in really growing this field of planetary health, and Howie Frumkin, who's been just a great thought partner for me over the last couple of years and catalyzed a lot of the thoughts I want to share with you. Clearly my intellectual debts go well beyond those, but in the interest of time, I should probably get started. So, on Christmas Eve in 1968, Bill Anders looked out the window of the first manned spacecraft ever to orbit the moon and took this photograph of Earth rising up above the moon's horizon. It was the first time that a human being had gotten far enough away from our planet to see it as a separate entity, whole and distinct. And it was breathtaking. Anders would write later, "We came all this way to explore the moon, but the most important thing is that we discovered the Earth." This image and others from subsequent Apollo missions became iconic images for the environmental movement and the first Earth Day in 1970. They came to symbolize our planet's beauty, isolation, fragility, and apparently unique capacity to support life. The same awesome technological mastery that propelled Anders up to the moon was also fueling an extraordinary expansion of humanity's global ecological footprint, the sum total of our impacts across our planet's natural systems and resources. The same time that Anders was coming back with images of Earth from space, we were entering a new geological epoch, the Anthropocene, in which human activity had become the dominant force shaping our planet's biophysical conditions. We're now in a period that Stefan and colleagues have called the Great Acceleration, where the impact of our activities across natural systems is intensifying almost exponentially. These are graphs of human consumption over time, and whether we're looking at appropriation of fresh water or proliferation of motor vehicles or production and use of synthetic fertilizers, paper production, plastic production, primary energy use, the graphs look very similar and show a pattern of extraordinary acceleration in our consumption over the last several decades since 1950. Not surprisingly, graphs that look at our impact across our planet's natural systems follow a similar pattern, whether we're looking at biodiversity loss or exploitation of fisheries or addition of carbon dioxide to the atmosphere or ocean acidification or tropical forest loss. What we see is this pattern of pervasive and very recent degradation of most of the natural systems across our globe. Most recently, just a few weeks ago, we learned from a study done here in Europe that investigators looking at 63 protected areas in Germany found that the total biomass of all flying insects has dropped by 76% in only the past 27 years. Not surprisingly, this great acceleration has led to what Gus Speth has called the great collision between humanity and our planet's natural system. So driven by these rapid increases in human population and even steeper rises in our per capita consumption, the scale of our impacts across natural systems is really hard to overstate. In order to feed ourselves, we annually appropriate around 40% of the ice-free, desert-free land surface for croplands and pasture. We use about half the accessible fresh water on the planet, mostly to irrigate our crops. We fish about 90% of monitored fisheries at or well beyond their maximum sustainable yields. In the process, we've cut down between 7 and 11 million square kilometers of the world's forests and dammed over 60% of its rivers. The quality of our air and water and land is diminishing in many parts of the world as a result of global pollution. And as a result of all of these processes and many others, we're now driving species extinct at about 1,000 times the baseline rate. The population sizes of mammals, birds, fishes, amphibians, and reptiles has fallen by around 50% in only the last 45 years. So paradoxically, these deeply worrisome trends have been accompanied by steady improvements in most metrics of human health. Maybe because some of the same scientific and technological developments that have intensified our impacts across natural systems have also improved access to plentiful, inexpensive energy, increased per capita food production despite steep rises in population, and reduced global poverty. The result have been really impressive improvements in life expectancy, going from 47 years in the 50s up to 69 in the last decade. And child mortality has fallen really steeply from 214 per 1,000 live births all the way down to 59 per 1,000 in the last decade. So in 2015, in the commission that Richard was talking about, the Rockefeller Foundation Lancet Commission on Planetary Health, we addressed this apparent ecological paradox, that the state of human health and our natural systems seems to be trending in opposite directions. And we concluded as a commission that we're concerned that the explanation is straightforward and sobering, that we've been mortgaging the health of future generations to realize economic and development gains in the present. By unsustainably exploiting nature's resources, human civilization has flourished, but now risks substantial health effects from the degradation of nature's life support systems in the future. So essentially, we're flagging this enormous issue of intergenerational equity, that we are reaping the benefits of unsustainable resource while we defray the costs to future generations. And just as we've learned over the last several decades that there are really important social and cultural and political determinants of human health, we're now coming to understand that there are also critical ecological determinants, that indeed human health is nested in this set of environmental conditions that impact nearly every dimension of health in a variety of complex ways. And this growing awareness that rapid environmental change is driving large burdens of disease today, which are likely to be even larger in the future, has given rise to the emergence of this new field of planetary health. So here's another way to think about it. The core premise of planetary health is that human population growth and other demographic shifts combined with new technologies and steep increases in per capita consumption have meant that the scale of the human enterprise now exceeds our planet's capacity to provide resources, to absorb our wastes, to maintain stable biophysical conditions. And the result is this sort of web of large-scale interacting changes in natural systems, each one of which is changing faster than ever before in the history of our species. So disruption of the global climate system, pollution of air, land, and water, loss of biodiversity, reconfiguration of the carbon, nitrogen, and phosphorus cycles, pervasive changes in land use and land cover, and scarcity of resources like water and arable land. And that those are all interacting with each other in complex ways that we don't fully understand to alter these fundamental conditions for human health. So the quality of air we breathe, the water that we drink, the kinds of food that we can produce, our exposure to infectious disease and natural hazards, and through those changes ultimately affect nearly every dimension of health. So what's the evidence for all of this? I mean, it sounds good, as my father-in-law likes to say, it sounds good if you say it fast enough, but is there really any evidence that this pervasive environmental change is more than an environmental crisis, that it actually represents a public health crisis? And I want to take a little time to actually review what some of that evidence looks like across the different dimensions of health. And I thought I'd start with nutrition and telling you just a little bit about some of the work that I've been involved in. These are 3 projects that I've been helping to lead over the last decade or so. The first focuses on how anthropogenic carbon dioxide emissions affect the nutritional quality of the food we eat. The second focuses on the health impacts of global pollinator declines. And the third focuses on wild harvested fisheries and how changes in access to fisheries affect nutritional and health outcomes for populations around the world. So this first project was really stimulated by a fairly esoteric literature in which scientists had been growing crops at elevated carbon dioxide, but mostly with fairly small sample sizes and mostly in greenhouses and chambers. And their findings were that there seemed to be really significant reductions in the nutrient profile of those crops. But they were also contested because they didn't have a lot of statistical power, and the growing conditions were pretty artificial. And so I helped to bring together a coalition of agronomists from around the world who were using what is now considered the sort of gold standard for this kind of research, which is this FACE, or free air carbon dioxide enrichment methodology. And using these methods, you can grow crops inside these rings of carbon dioxide emitting jets. And you can maintain CO2 within those rings at a prescribed level. In the case of our experiments, that was 550 parts per million, which is where we expect to be about the middle of this century. And then you can look at the difference between identical cultivars of plants grown inside the ring at elevated CO2 and those grown outside the ring at ambient CO2, and isolate that CO2 effect while still growing plants in open field conditions with identical exposures to weather and pests, etc. So bringing together those agronomists, we were able to grow 41 cultivars of 6 staple food crops on 7 locations across 3 continents over 10 years. And that gave us a large enough sample size so that we did have the statistical power to really resolve this question. And we found that indeed anthropogenic carbon dioxide emissions were threatening human nutrition. We found overall that staple food crops were losing iron and zinc, that grains like wheat and rice were also losing protein, that C4 crops like maize and some of the millets and sorghum were less affected. And it was concerning because about 2.75 billion people around the world are getting at least 70% of their dietary zinc and or iron from the kinds of crops that were losing those nutrients. It's also concerning because this is a huge public health problem right now today. So around 2 billion people suffer from iron and zinc deficiency at a cost of around 60 million life years lost annually. But the next question is really, so what? So how many people are going to be pushed into nutrient deficiencies? And to answer that question, you actually need to be able to estimate what people are eating around the world. And it turns out we have terrible estimates of what people are eating. And so we ended up having to build a whole new database that we call the genus database, which estimates the per capita intake of 225 different foods for the populations of 152 countries, with the nutrient densities of each one of those foods for 23 nutrients. And then using that database, we could do scenario analyses where we looked at the total intake of nutrients like iron and zinc and protein under today's CO2 level and elevated CO2 levels. We published the first paper describing our findings focused on zinc in 2015, in which we found that the effect of these rising CO2 levels would be to push approximately 150 to 200 million people into new onset of zinc deficiency, in addition to exacerbating the existing deficiencies in around 1 billion people. Just this past August, we published 2 more papers for protein and iron. We found similar effects for protein, that we anticipated about 150 million people being pushed into new risk of protein deficiency. These effects are very heterogeneous, so places like India seem to experience really outsized effects in parts of Africa where other populations are more protected. And for iron, we found that 1.4 billion women in their childbearing ages and children under the age of 5 live in areas which already experience severe anemia, greater than 20% rates of anemia, and will be expected to lose more than 3.8% of their dietary iron as a result of this CO2 effect. So the second study is to look at pollinator declines. We know that pollinators like bees and other kinds of insects are responsible for producing large shares of the calories and micronutrients in the global diet, and we know that they're in decline around the world. I just told you what's happening to flying insects as a whole in Germany, and in general, pollinators around the world are in decline. And we were interested in really trying to quantify health effects, and specifically 5 different mechanisms, 2 deficiencies, so for vitamin A and folate, and 3 reductions in the intake of food groups, so for fruits, vegetables, and nuts and seeds. And so what we did was to combine that same genus database of what people are eating around the world with another database that essentially estimates the pollinator dependence of every single food crop on the planet. And by combining those, we could actually do scenario analyses to ask how different degrees of pollinator collapse would affect the production and then consumption of these different foods and what that would mean for burden of disease. What we found was fairly striking. So we found that in places like sub-Saharan Africa, South Asia, parts of Latin America, that you'd see large burdens of disease as a result of increased vitamin A and folate deficiencies. But we were more surprised to find that there would also be really big health effects across much of the more developed world. And those were as a result of increased prevalence of non-communicable diseases, of heart disease, stroke, diabetes, certain cancers, which would occur at higher frequencies because of the loss of the protective effect of consumption of fruits, vegetables, and nuts and seeds. So losing that prophylactic effect increases the risk of those diseases. Overall, we found that on the order of around 100 million people would get pushed into vitamin A and folate deficiencies, and that we could see with complete pollinator collapse up to 1.4 million excess deaths annually. The last project is still very much in progress, and it's looking at what's happening to global fisheries. So we know that overfishing and pollution and global warming and ocean warming is changing the population sizes and distribution of fish around the world. Our warming models, for example, make it clear that we can anticipate reductions in total amounts of fish, but also big shifts in their distribution away from the tropics and toward the poles. And so we're using a bioeconometric model in the middle of that to actually say, well, as those distributions shift, how might that alter the access and consumption of fish in the diet of these different populations in countries around the world? And that work is still very much in progress, but the first thing we did was to try to estimate our vulnerable population. And so we defined that vulnerable population as people that are living near a threshold of insufficient intake of important nutrients, so iron, zinc, omega-3 fatty acids, vitamin B12, and who receive important amounts of that nutrient, in this case more than 10% of that nutrient from wild harvested fish. And we were surprised to find that in fact there are almost 1 billion people who meet those criteria around the world. So there's a large vulnerable population and a lot of people at stake. So that was work we published last year. So clearly this is just shining the smallest of lights on a very, very large landscape. There are many. I've talked about the effect of CO2 on crop nutrients. There clearly are much more important effects of climate change itself on global food production. I've talked about pollinator declines and fisheries collapse. We're also working in Madagascar on how wildlife population declines affect nutrition of people that are consuming bushmeat. But there are really important effects of growing water scarcity, land degradation. Clearly population displacement affects access to food in important ways. Pollution affects crop yields. And there's no question that as we remake just about every biophysical condition that underpins our global food production system, there will continue to be surprises. And this is just one dimension of health. So, this is the nutrition story. We could put together an equally complex picture for the other dimensions of health. And what I want to do is just give you a quick set of snapshots across some of those other dimensions to give you a feel for what that research looks like. So many of you in this audience are much more capable than I to speak to how much our exposure to infectious disease depends on environmental conditions. These farmers in upland Belize are applying fertilizer to their fields to increase their yields. The nitrogen and phosphate in those fertilizers, some of it runs off and ends up in streams and rivers, and it makes its way hundreds of miles down to lowland Belize. In lowland Belize, it enters these wetland systems, and it triggers an ecological shift from one type of reedy vegetation to another. That ecological shift, that vegetation shift, creates a different kind of habitat, which favors a different Anopheles mosquito, Anopheles vestipanus over Anopheles albuminus. That matters because Anopheles vestipanus, because of its feeding behavior, is a more effective malaria vector. So inadvertently, these upland farmers, by applying fertilizer, have triggered a whole sort of cascade of ecological shifts that increases malaria exposure for their lowland compatriots. And surprisingly, this is a fairly universal finding. So in this meta-analysis of 41 pathogens on 6 continents, nutrient enrichment increased disease exposure most of the time. I don't understand why that's the case. It seems counterintuitive to me, but that's what they found. And clearly there are many other aspects of changing environmental conditions that will affect our exposure to infectious disease. So the warming temperatures and changes in soil moisture and changes in precipitation associated with climate change will affect the habitat and life cycle and feeding behavior of many important vectors for important vector-borne diseases. Land use change, things like deforestation, dams, irrigation schemes are notorious for increasing our exposure to diseases like malaria and schistosomiasis and Japanese encephalitis and many others. And it also turns out that changes in the actual species composition of biological communities can have significant impacts on our exposure to disease. And for reasons, again, that aren't very well understood, as we remove species from a system as a result of habitat fragmentation or other drivers, the species that remain tend to be the more competent vectors or hosts for disease. And clearly that's not universally true, but empirical observation would suggest that it's true more often than not. Population displacement and conflict is another aspect of human health that clearly has strong ties to environmental change. Last year, the United Nations High Commission on Refugees documented the largest number of displaced people in the history of its record keeping. 65.6 million people, half of them children, were forced to leave their homes. The exact contribution of accelerating environmental change in driving displacement and conflict is still very uncertain, and the exact numbers of people that will be forced to move as a result of more extreme weather events, rising seas, failing crops, or resource scarcity remains unclear. Most analysts see environmental change as a threat magnifier in situations that have complex and multifactorial etiologies. So we're all intensely aware of the Syrian civil war and the massive number of displaced people that have resulted from that have sent ripple effects really throughout the rest of the world. Clearly, that has a complex etiology that includes poor governance, rapid human population growth, and poor agricultural and environmental policies. But it was also significantly exacerbated by the worst 3-year drought on the instrumental record. And there's strong evidence that that drought was made much more likely in the context of climate change. So I think it stands to reason that the combination of sea level rise and lower crop yields and more extreme weather events, coupled with growing water scarcity and land degradation, is going to push more and more people, many with very few resources, to seek new homes. And we know that that kind of displacement has big health effects. So as a result of associated undernutrition, epidemic infectious disease, physical, sexual, and psychological trauma, mental illness, I think it's probably likely that displacement and conflict will drive some of the largest burdens of disease associated with environmental change, but there's a lot that we need to do to really understand and quantify those dynamics, and I would argue that's an urgent research priority. What about non-communicable disease? I mean, it seems sort of counterintuitive that environmental change would affect non-communicable disease the same way, but in fact, that's probably not the case. So planetary scale pollution is probably the single biggest driver of non-communicable disease. The Lancet just published a really extraordinary report of its Commission on Global Pollution and Health, in which they estimated that in 2015 there were 9 million excess deaths as a result of pollution of air and water and land. They estimated that 21% of cardiac deaths, 23% of stroke deaths, 8% of COPD deaths, and 25% of lung cancer deaths were the result of pollution. And it's not just pollution. So I already mentioned in our pollinator work that the largest burdens of disease were due to non-communicable diseases as a result of the loss of that protective effect of consumption of pollinator-dependent crops. I'm also a little bit concerned about our finding that not only is rising CO2 reducing the nutrient content of some really important nutrients, but it's creating this global dietary substitution experiment where essentially we're replacing a lot of dietary protein with dietary starch. Now, when we've done that experiment intentionally in subjects, like in the Omni-Heart study, we found that substituting starch for protein causes higher rates of hypertension, worse lipid profiles, and increased estimated risks of heart disease. We're now doing that experiment at a global scale with our whole food supply, not at the same levels that the Omni study was done at, and we don't really understand the full implications or whether that will impact non-communicable disease. And the last example I wanted to share comes from many of you here in London. I don't know if any of the investigators are here right now, but I wouldn't be surprised. I see Pauline, where you all have been looking at how a combination of sea level rise and poor water resource management and damming of rivers has led to an increase in groundwater salinity in Bangladesh, and have done beautiful work showing that there is a very clear correlation between groundwater salinity and the incidence of gestational hypertension and preeclampsia. In addition, there's a clear correlation between groundwater salinity and incidence of hypertension in the general population and these coastal populations. Finally, but certainly not least, there are important mental health effects. So, we in the United States are sort of reeling from this fall's kind of serial set of episodes where we had Hurricane Irma, Hurricane Maria, Hurricane Harvey, and then the worst set of forest fires in the history of California, all in rapid succession, sometimes overlapping, and just massive fatalities, hundreds of thousands of people displaced from their homes, and clearly enormous burdens of mental illness as a result of those effects. Displacement itself is known to cause significant burdens of mental illness. We know from studies that in children and adolescents in refugee camps, between 30 and 75% have symptoms of post-traumatic stress disorder. Maybe more universally, Glenn Albrecht, the Australian philosopher, has coined this term solastalgia to mean the grief and anxiety that we experience at the loss of cherished places. More recently, I've started to wonder whether there isn't also sort of an anticipatory solastalgia. What does it mean for a Pacific Islander to wonder whether their children or their grandchildren will ever live in the place that they call home, or somebody up in the far north? What does it mean for us to wonder whether our children or grandchildren will ever see a flourishing coral reef, or rhinoceroses or elephants in the wild? And even subtler still, what is the burden for bringing our children into a world where they're going to know that it was our consumption patterns in the wealthy part of the world that are putting the poorest people in harm's way? And what are the mental health effects of that? These are all open questions. They don't have answers, but I would argue that they're rich fodder for the sort of emerging field of psychiatric epidemiology. So my goal here has not been to try to be completely comprehensive in cataloging all the evidence for planetary health across every dimension, but to give you a feel for what it looks like. And I hope that a few sort of overarching themes can emerge that I'd like to talk a little bit more about. The first is that the health effects of changes in natural systems are often direct and intuitive. So the triple threat associated with sea level rise, more extreme coastal storms, and loss of barrier systems like mangrove forests and coral reefs and wetlands and vegetated dunes will clearly increase the vulnerability of coastal populations. Climate change coupled with water scarcity and land degradation clearly represent headwinds for food production. But a lot of the findings that have been coming out of planetary health science are more surprising. It would have been hard to anticipate 15 years ago that our carbon dioxide emissions would impoverish the global food supply with respect to nutrients. It would have been difficult to anticipate that sea level rise and poor water resource management would cause women in Bangladesh to experience higher rates of gestational hypertension or preeclampsia. I think that farmer in upland Belize would be surprised to learn that his application of fertilizers was putting his compatriots in lowland Belize at risk for higher rates of malaria. I think we can anticipate a lot more of these surprises as we remake the biophysical conditions within which we live with very little understanding of the consequences. The second idea is that different populations will experience these effects differently. So partly that's because environmental conditions change in different ways in different places, but it's also because characteristics of a population will define its vulnerability. So people with access to good governance and wealth and philanthropy and robust technologies and aspects of culture and behavior can protect a population from the worst effects of changing environmental conditions. Clearly, a community that can build a seawall in response to rising sea levels or turn on the air conditioning during an extreme heat event fares better than the community that cannot. Food trade will protect communities from local crop failures, but only if they have the resources to access those food markets. And so while the drivers of these health effects may be environmental change, at least in the short term, there's often an opportunity to address those effects by focusing on these mediating factors and trying to reduce vulnerability. A community in the highlands of sub-Saharan Africa that's experiencing higher rates of malaria with global warming would probably do better to focus on bed nets than trying to address climate change at the local level. And most of the activities that change environmental conditions wouldn't be undertaken if they didn't benefit someone. We build dams to generate power and gain access to water for irrigation. We burn fossil fuels to generate energy. We cut forests and appropriate water to grow our crops. We mine minerals to create the conveniences of modern life. But often there is a sharp contrast between those who benefit from those activities and those who pay the costs in degraded health. So a new dam may provide power for a town or city, while the local villagers experience only increased exposure to schistosomiasis. And a coal-fired power plant may provide energy for a whole region, but downwind communities will experience degraded air, and future generations will bear the burden of a disrupted climate system. In that context, health impact assessments need to look very carefully at the distribution of costs and benefits across different populations and over time, with a particular focus on equity. I think planetary health science also places us in new ethical terrain. It teaches us that each one of us is connected to every other person, present and future, on the planet. Every decision that we make, what we eat, how we get around, where we go on vacation, what we purchase, whether we have a pet, even how many children we have, ultimately impacts our planet's natural systems and, as a result, the health and well-being of everybody else on the planet. The impact of each individual decision is infinitesimally small, but collectively they are enormous. It also highlights a closely related issue of equity. In most instances, it's the poorest people in the world with the fewest cultural and governmental and philanthropic and technological resources to protect them who experience the worst impacts of environmental change. It's the poorest people in the world with the least diverse diets who have the most nutritional vulnerability to rising carbon dioxide levels, and yet it's the wealthiest people that are actually responsible for most of those emissions. Future generations will suffer the consequences of today's unsustainable resource use. And this disconnect between those who get the benefits and those who suffer the consequences is deeply unfair. In that context, redoubling our efforts to protect our natural systems becomes not only a public health priority, but also, I would argue, a moral imperative. Another result of planetary health science is it helps us to quantify health costs that have been, until now, really sort of vague externalities. Most of the activities that transform natural systems are the result of some kind of economic activity at a variety of different scales. But in assessing the costs and benefits of those activities, the health effects of environmental transformation have largely been left out. So in determining the social cost of carbon emissions, or the value of a new dam project in West Africa, or the effect of palm oil production in Indonesia, quantifying the health impacts of those activities can often change the cost-benefit equation dramatically. So for example, in Southeast Asia, industries that use fire to clear land, palm oil, timber, logging industries, lost some of their luster when we showed that those fires are producing air pollution that caused around 100,000 excess deaths in 2015. Finally, I would ask you whether maybe a quieter voice is speaking through some of these examples. James Irwin, the eighth man to walk on the moon, described his view of Earth. Quote, "That beautiful, warm, living object looked so fragile, so delicate, that if you touched it with a finger, it would crumble and fall apart. Seeing this has to change a man, has to make a man appreciate the creation of God." During the Enlightenment, much of Western civilization embraced a Cartesian dualism, emphasizing the material and scientifically accessible over the spiritual. The scientific understanding and technological mastery that ensued has engendered enormous benefits for all of us. But I wonder if it has also blinded us to other ways of knowing. Astronauts who are viewing Earth from space don't extol the virtues of the science and technology that brought them there, although they certainly would have every reason to do so. They invoke the language of reverence and awe. And we in Western society, and certainly in the scientific community, have really moved away from that language in talking about the natural systems that sustain us. I think we scientists view our spirituality as sort of an embarrassing vestigial appendage, certainly not to be brought out in public. And I wonder whether indigenous knowledge systems and faith traditions might have a necessary role to play in reconnecting us with other ways of knowing that are more consistent with stewardship of our natural systems. So, where do we go from here? I think we need to start by acknowledging the size of the challenge that we face. Our house is on fire. Natural systems are starting to crumble around us. The climate system, our oceans, our terrestrial ecosystems, and the biodiversity that inhabits them. And we are in peril. There's an urgency, I think, to acknowledging the predicament that we're in and taking action to get back on track. But I think these challenges, despite their size, can be met. I see no reason why our children's children can't live in a world where human population has stabilized, where most of us are living in cities that have been designed to minimize their ecological footprints and optimize health and well-being, where every passing decade brings more breathing room, not less, for the rest of the biosphere. I remember as a young medical resident at San Francisco General Hospital, the feeling of deep futility as I watched the same patients with the same conditions coming back to the hospital again and again. Alcoholic hepatitis in alcoholics, COPD in smokers, cellulitis in injection drug users, pneumonia in the homeless. And I remember wondering if we couldn't meet these patients' needs in ways that better address their root causes. I remember feeling that we needed to go further upstream and expand our conception of what it meant to be a physician. Today, I would argue that we need a similar expansion for the field of public health, that we need to go much further upstream. Vaccinations, vitamin A supplementation, prenatal care, smoking cessation programs, seatbelts, these are critical features of public health. But they aren't enough. I think we need to expand the realm of public health to include how we manage our planet's natural systems, what kinds of cities we construct, how we generate our energy, how we produce our food, how well we protect our marine and terrestrial biodiversity. In the context of planetary health, the borders and boundaries between public health and nearly every other dimension of human activity become more porous. I think we need a new paradigm. We need new partnerships and organizational structures. Public health researchers and practitioners need to move outside of their disciplines and create partnerships that take them well outside the traditional boundaries of public health. Land use planners, urban designers, ecologists, civil engineers, agronomists are as much the partners of a planetary health practitioner as physicians and nurses and epidemiologists. I think universities need to restructure to be able to tackle the kinds of challenges that I'm talking about. Planetary health problems don't fit neatly within departments, or really even within schools at a university. Structures that allow public health practitioners to work well with their colleagues in natural and social sciences and even the humanities will be critical in addressing these challenges. We need new funding structures. Funding for planetary health science is completely inadequate to the urgency of the research questions that we face. Government funders that fund within disciplinary silos or with a focus on particular diseases or organ systems have handicapped themselves in addressing some of society's most urgent priorities. They could break out of those silos and create cross-agency collaborations and set up distinct institutes to fund planetary health science. And in the shorter term, private foundations have a really, really critical role to play in catalyzing the kind of research that will grow our understanding of how the management of our planet's natural systems is central to future health and well-being. If we can meet some of those challenges, I think that we can build a robust new science of planetary health, and from that will come the knowledge we need to inform a whole new class of solutions. We explored the kinds of solutions in more depth in the Commission report. I think there are, almost every dimension of human activity provides enormous opportunities to be more efficient in our use of resources and to do a better job protecting our natural systems. We could rethink our food system to produce more nutritious diets that also have lower ecological footprints. The for-profit and manufacturing sectors have a huge amount to offer in promoting more circular economies with more reuse and recycling of materials, but also just innovative approaches that, because they're for-profit, can go to scale for addressing many of the challenges that we face. We need to design our cities so that they have reduced ecological footprints while improving mental and physical health. There are extraordinary opportunities in how we govern at really every scale, from local all the way up to international, to reduce perverse subsidies, to increase incentives, to create international regulatory frameworks for our commons, and then use new technologies to survey those commons and make sure that regulations are being enforced. And as I mentioned, I think that large investment should require planetary health impact assessments that look at the distribution of costs and benefits across populations and over time before making those investments. Finally, maybe one of the greatest challenges that we face is what we called in the Commission report the challenge of imagination. I think we need to rethink our place in the world. I think we need to reject the narrative that streams into our houses every single day that we can achieve happiness by relentlessly acquiring more stuff. We need to embrace what we know to be true from our social scientist colleagues, that what actually makes us happy is time spent with the people that we love, feeling connected to cherished places and communities, a sense of connection to something larger than ourselves, taking care of each other. It's hard to know exactly what was going through Bill Anders' mind when he said that we need to go to the moon in order to discover the Earth. Maybe one of the reasons why so many of us are mesmerized by those self-portraits from space is not only the swirling beauty of patterns of blue and white, but also a new awareness that they evoke. Viewed from space, our planet is beautiful and unique, yes, but it's also small and somewhat shockingly contained. These are not images consistent with limitless resources or an unlimited capacity to absorb our waste. They evoke awe, but also an instinct to protect and nurture. Another American astronaut and the sixth person to walk on the moon, Edgar Mitchell, described the Earth rise from the moon's surface. Quote, Suddenly, from behind the rim of the moon, in long, slow-motion moments of immense majesty, there emerges a sparkling blue and white jewel, a light, delicate sky-blue sphere, laced with slowly swirling veils of white, rising gradually like a small pearl in a thick sea of black mystery. It takes more than a moment to fully realize this is Earth, home, unquote. And Russian cosmonaut Alexei Leonov reflected, quote, "The Earth was small, light blue, and so touchingly alone, our home that must be defended like a holy relic," unquote. When Anders wrote that he discovered the Earth, perhaps what he meant is that we discovered a new relationship to our planet, that our home is awe-inspiring and fragile, and that just as it nurtures us and all living things, it also requires our care. Thank you.